Welcome, we'll get started.
Okay.
So I'm pretty familiar with most individuals here. Usually I start with an introduction to myself, but I'll start with an introduction for you guys. So if you would let me know your name
Terry.
and what concerns you or what intrigues you about coming to this presentation. Provide some background about the clinic. A couple of you already know that. Who the individuals are here that are in the clinic and what our perspective is. And then we'll uncover some information about dry needling, compare dry needling to acupuncture. Hopefully you can hear me okay. If not, frankly, I would suggest that you maybe move to the front row, seriously. Because my voice will probably hold out for the day, but I'm not sure how much longer. So thank you. So dry needling for relieving pain and getting back to your active life. So at Physical Achievement Center, we help people achieve greater mobility and strength for their active life without medication, drugs, or surgery. That's the mission of the clinic. Since its inception, we've been here 5 years. I've got over 30 years of clinical experience, nearly all of that in Oshkosh. I've had the privilege of being trained as a fellow in physical therapy, which means I took an opportunity to study clinical application and evidence-based interventions for pain relief from head to toe, and had an opportunity to help a few folks if you've been treating that long in the area. Dr. Rebecca has been with us for over a year and a half. She's got over 10 years of experience. She's got a fellowship in applied gray science movement, which is kind of integrated way of looking at how the spine, ribs, upper body, and lower body kind of all work together. She's a phenomenal therapist. She was voted a Physical Therapist of the Year in Wisconsin in 2017.
Cool.
And we know why. Patients really enjoy working with her. Dr. Jessica is a graduate of Marquette University. She's been out a little less than a year. Her mother, older sister, younger brother are all physical therapists or in physical therapy college. So she comes from a family of physical therapists. So she really understands the profession really well. She's got certification in vestibular and dizziness issues. She's a certified dry needling specialist. And she's also got some specialty training in vestibular rehabilitation. And Gina's a physical therapist assistant. She celebrated 1 year with us today. And she's got specialty trained in pain relief and sports recovery massage. She's a certified spine specialist and certified upper extremity specialist. So we value training, of course. The newer physical therapist assistant to our team, and Courtney. Courtney hasn't made the slide yet, but she's been with us for about a week now. So
I saw her once. I really like her.
good.
Yeah.
Yeah, she's got great presence.
She knows a lot.
Excellent. So glad you enjoyed her. Yeah. So I've got a slide for this, but why did I start the clinic? I was actually fairly content with 8 weeks of vacation as a state of Wisconsin employee. When I got through fellowship training, I realized there's a massive gap between what's available and offered. What's available for people for conservative care for treatment of movement and pain related disorders, and what's actually being offered. So I've been in the community nearly all my adult life, raised my family here, and I was just kind of frustrated at hearing family, friends, and neighbors not being offered all their options or the best options in terms of their health when it comes to muscle, bone, and joint conditions. There's a huge sucking sound towards high-price imagery and surgeries and medications. I don't have anything against some of that stuff, but it's way overutilized. I don't think there can be any disagreement about that. And it's a wide gap between what the research shows and what is actually being offered to folks. And oftentimes conservative care isn't even discussed. I'll give you a case in point. I did a shoulder presentation, I think about 2 months back now, and 3 of the individuals in that class went to the same orthopedist for a shoulder pain complaint. And as a first line of treatment, before even medications, before any therapy, any injections, anything, they're offered a shoulder replacement surgery
Oh my God.
as the first line of treatment.
Wow.
I was dumbfounded, but all three, and then they all said, well, who'd you go see? And they all said the same provider. I'm like, this is insane. So that's just one case in point. So we're about educating patients, and we want to make people make better healthcare decisions. So a key thing that we want to keep in mind is we've been doing educational workshops for quite a few years. Jim, I think you came to one of ours a while back, and I'm not sure, Terry, if you were introduced to us through an educational workshop or not. But there's this concept called evidence-based practice. Anybody ever heard of it?
Oh, I did go to one of yours. That's why I came here.
Oh my goodness, yeah. So evidence-based practice is basically how can we predict, how can we figure out what the best treatment options are for individuals. So when you have a really good relationship between what the patient prefers, what the provider is skilled in, and what the research supports, when you have commonality in that, hey guys. And here's the start of the show. We'll do the rest of the presentation. So when you have a combination of what the patient really values, what the providers it has good skill in, and what evidence supports, when there's commonality in there, and that treatment is implemented, chances are really good that's going to be a successful outcome. Does that make sense?
Mm-hmm.
So here's the thing. I think the patient is at the center of healthcare because that's what drives everything, right? Mm-hmm. And but can you make the best decisions if you don't have all the choices? Obviously you can't, right? So this is an opportunity to learn about some choices that might be available for individuals to expand their horizons so they can have more in-depth conversations. Does that make sense? Mm-hmm. Yeah. So I was also, we're also biased towards obviously non-surgical, non-drug things. That's an old picture of some of the team. We've got newer folks in there. I think Robin's in there and Kelly's in the back. We've got Kelly 1 and Kelly 2.
Yeah.
And I think I'm missing somebody. Courtney's not in it either, but anyway. So we want to be the source if people are unsure, unstuck, or not quite sure what to do for their pain, weakness, or imbalance. And we want to make sure no one's ever disrespected by saying something like, what do you expect? It's your age.
Mm-hmm.
Like, I know sometimes we can chuckle about it, but I think it's extremely disrespectful. Mm-hmm. If you can't help somebody, let them know. But we shouldn't assume that advanced ages necessarily brings challenges. There's no doubt about that. But that doesn't mean you're what the word I'm looking for, like determined to have significant pain and disability. Mm-hmm. That should not be the norm, and that's not the norm for many people. And shouldn't be considered like, oh yeah, everybody's going to have that at some age. That's not acceptable. Or you just have to live with it. Again, if you can't help somebody, just let them know. Mm-hmm. I actually thought, because the strength of the evidence year by year is getting better and better. How do I know that? Because I review medical literature. I get weekly emails from different sources. And there's so many muscle and bone and joint conditions in which either conservative care is better than or equal to higher priced, riskier care, or the term that they'll oftentimes use in the medical journal is it is non-inferior to surgical care. Basically, they don't want to phrase it like, hey, it's not better than. They want to use fancier words for it, right? And I actually thought, can the clinic continue to serve people this way, even as that evidence continues to mount, month by month, year by year, and in some ways the gap is even widening between the evidence and what's offered, as evidenced by that experience of those individuals who unfortunately weren't offered any other options other than surgery for first line of treatment for shoulder pain. So that's a little background on the clinic, and I don't, we think it's important to understand what the perspective of the person is in front of you. This I will say, that if someone comes here for treatment, they will know that they've exhausted conservative care. Like, we will be voracious in helping people recover. That's what we do. That's our bread and butter. I'm looking to partner with medical providers who are like-minded. I'm looking to provide referrals to individuals who are going to be more thoughtful, and I have a hard time doing that. I don't need to please a physician. They don't refer to us on a routine basis because they work for other systems, and they have other referral relationships. But
Mine referred me,
that's awesome.
but she left now.
I'm not, yeah.
Dr.
There's a
Miller,
few that do, right? But in general, they don't. I don't have to basically kiss up to, and because of that, I can have frank conversations. I don't disrespect other medical providers. Everybody's got challenging work, but at the same time, being an independent practice allows me to have conversations that are adult-like, straightforward, matter of fact, so that everything's out there. So, all right. So we'll talk about what is dry needling. So just exhausting my last cough drop. Hopefully we'll get through this talk. So dry needling is use of monofilament needles that are thin, basically acupuncture needles, without injections, right? So that's why it's called dry. Into myofascial trigger points, which are painful knots, tendons, ligaments, joints, or in nerves in order to stimulate a healing response in painful conditions, such as lower back and neck pain, sciatica, shoulder impingement, rotator cuff problems, knee arthritis and pain. We're going to talk about that quite a lot. Foot pain, tennis elbow. Clinical review just came out and showed that tennis elbow, dry needling is becoming a strong recommendation for that based on the research. Headaches, multiple types, including tension, migraines, and neck-related, dizziness-related to upper neck issues, hip pain, stiff, limited, painful scars. So is it the same as acupuncture? What's the difference? So we'll talk about that a little bit. I've been a consumer of both acupuncture and dry needling, actually before I got trained in dry needling. So there are different experiences and there's different goals. Acupuncture focuses on the flow of energy through the body, those channels in the body that the Chinese medicine is concerned about are called meridians. They're interested in improving the balance of flow through those meridians. Acupuncture is a way for the acupuncturists to affect the flow of energy through those channels. As physical therapists doing dry needling, we barely understand that sort of thing, so we're not interested in that. So acupuncture is rooted in traditional Chinese medicine, and there's some distinct differences. So I want to be clear that I have a healthy relationship. I have a healthy respect for acupuncture and physical therapy professions, and then this presentation is based on my clinical experience. I'm going to provide conversations that some professionals may want to avoid, but I want to be very clear that I have respect for all folks who work to help improve the lives of their patients. All right. So, this summary comparison between acupuncture and dry needling. So the basis of dry needling is a modern scientific method. We took a look at some observations and do a review of research, and then take a look at anatomical anatomy, if you will, to decide how we're going to do dry needling. Acupuncture is rooted in traditional Chinese medicine. Purpose of the dry needling is to restore pain, restore flexibility, reduce inflammation, promote better movements, and improve posture. That's our focus. In acupuncture, the goal is to restore the proper balance of qi along traditional energy channels in the body. Dry needling, as done by doctors of physical therapy, the baseline training is 7 years as a doctor of physical therapy with over 2,000 clinical hours. Baseline training for an acupuncturist It's a 2-year certificate with 600 clinical training hours. Is it research proving? Dry needling has variable outcomes in research. It's much better. It's combined with hands-on care and exercise. Acupuncture similarly has variable outcomes, and it's oftentimes the focus of traditional Chinese medical research. Insurance coverage, bottom line is rarely does insurance cover either. There are some exceptions, but for the most part it doesn't. Is dry needling effective? Is the next question. Well, I probably wouldn't be here talking about it if it wasn't, right? But that's a good question to ask, and it actually depends. There's when research looks at 2 different types of dry needling, one of them doesn't do so well. One of them is trigger point dry needling versus what I refer to as comprehensive needling. I'm going to define each of those and how they're different and why there's 2 different types that physical therapists tend to use. So does anybody know what a trigger point is?
Yeah.
Usually people take their finger
It's
and
like,
go,
I got fibromyalgia, yeah.
yeah, right. You can put your finger on one. Most people have one here, right? So it's a painful muscle knot that when you press on, you can get a jump sign. Like, ooh, that's a jump sign. Fancy term for it, right? It can also refer some pain, away. When we take a look at what's going on in an area that's a trigger point, we can't really find a lot anatomically. If we do a dissection of that tissue, we don't find much. There might be some additional chemicals in that area, like acetylcholine, but there's nothing we can really find in examination. We just kind of know it, like a painful muscle knot that produces pain. If that painful knot produces pain that's similar to the type of pain that we've got, it's significant. We should take a look at it. Trigger point dry needling is about finding painful muscles and then inserting a needle into it, and oftentimes fairly ambitiously, maybe pisting that needle up and down, and it can be kind of not that comfortable. So if you've ever had a cramp and someone's taken their finger, or you taking your finger tugged right in it, kind of like, ooh. And it can calm that trigger point down. However, the research on the support of this is very poor. Like, don't see a lot of good outcomes with this when it comes to research. Not to say that it hasn't helped some people, but overall, when we look at it from a research perspective, it's not that effective. Comprehensive dry needling is a little bit differently. Comprehensive dry needling is actually based a little bit more similar to how acupuncturists would do it, in that we use more than a few needles, depending upon the body parts. This is an illustration of, I think that's a right knee up there, protocol for comprehensive dry needling. There's 9 needles here, and those needles are based on a study that was completed to find out what helps for people with knee osteoarthritis. And that's what that image is of. We'll talk about that in a little bit. So comprehensive dry needling uses kind of protocols based on high quality acupuncture research and clinical trials in the physical therapy world. So even though we're not acupuncturists, we can still take a look at some of the acupuncture literature, trace back to where, when research finds it's helpful for the conditions, find out what anatomical parts that those needles went into, and start to create programs based on that when they're found to be successful, if that makes sense. So we're going to do kind of a comparison between trigger point dry needling and comprehensive dry needling. Here we tend to do comprehensive dry needling. And we'll talk a little bit about why there's both. But once again, the number of needles in trigger point, 1 to 4 needles are used. Comprehensive needling, oftentimes more than 6, sometimes up to 20, maybe even 24.
At the same time?
Yeah.
Oh, wow.
Trigger point dry needling sometimes, maybe rarely, is there electrical stimulation applied to the needles. With comprehensive dry needling, almost always, as long as there's not a reason not to. needle manipulation that is kind of like pistoning or twisting, something like that. Typically in and out pistoning for trigger point dry needling, once the muscle is done twitching. The therapist pulls the needles out, puts them in the sharps drawer, gives themselves a high five because they took a muscle that was twitchy and jumpy to quiet. Physical therapists are really biased towards muscles. It's really satisfying to a physical therapist. So the muscle twitch may be effective, or maybe something we notice with comprehensive needling, but it's not the focus. It's an aspect of it. We'll generally want to do some manipulation of the needles, perhaps, but we also want to be sure that we consider the use of electrical current because that's what research shows is more that can be more helpful. Needles left in place in trigger point dry needling. The needles are left in place for a couple minutes. Comprehensive dry needling, typically 10 minutes or more. And that's based on research. Research in the comprehensive dry needling world and the acupuncture world shows that needles need to be placed for about 20 to 30 minutes for optimal benefit. So again, we're not acupuncturists, but we can use the long tradition of acupuncture to gain some benefits. If someone goes to an acupuncturist, they're going to be on needles for a while. So that's what we do, right? So use of bone and joint cartilage stimulation, so we can use needles to stimulate the bone and joint cartilage. Sometimes trigger point dry needling therapists will do that, and we'll absolutely do that when necessary because that can be beneficial for folks. So, any questions from that so far? All right. So why are there two different approaches? I think it comes down to a few things. Clinical training, like where did that therapist get their training? Convenience, and then the next one is to kind of please the insurance companies and to not have straightforward conversations with patients. So what do I mean by that? So the bias of the doctor of the physical therapy is based on their training in clinical procedures, right? So a couple things. First of all, avoidance of the acupuncture literature makes some needling just not that effective, right? If you're not going to tend to look at leaving needles in place, you're leaving benefits on the table. The bottom line is a lot of therapists like to bury the minutes of a treatment into a treatment plan and not have to either ask the patient for any money or kind of just, obviously we know the insurance companies aren't going to pay for it. And we don't really think that's appropriate, right? Because we're shortchanging the benefit. And if you feel it's valuable and there's a charge for it, just be honest about the charge. I don't work for insurance companies, I work for patients, right? I like this one. Go show them who's the boss.
It's my cat.
Exactly. So, I've talked a lot here. I wouldn't mind a little pause if anybody's got any questions to get some water. Anything so far? All right. So what are conditions that dry needling has research support for? The osteoarthritis and pain, a tremendous research project. And this research is so compelling that I tell all my knee osteoarthritic patients about it because I want them to know the benefits. I want them to be informed because at the end of a plan of care or midway, I don't want them to say, hey, do you think that dry needling stuff might be helpful? And feel like they missed out on something. So I want people to decide early up front if they would like to consider that, right? Because it's pretty convincing. So when combined with hands-on mobilization and individualized exercise prescription, dry needling is extremely effective. So let me explain that for a moment. For a lot of years, we knew that exercise and hands-on work for the knee, exercise, hands-on work is very effective, but when you compare that to exercise and hands-on work plus dry needling, both groups could do better, but those that have the dry needling, for treatments that average only 10.5 sessions, they have significantly lower levels of pain, significantly lower levels of medication use for pain, and significantly increase strength and daily performance, right? It's pretty spectacular. So it enhances that benefit of the hands-on work exercise prescription. This again, an illustration of the protocol for knee pain. Chronic lower back pain, generally lots of needles are needed. There's a really good research project that came out in the Annals of Internal Medicine. It was a pretty top tier medical journal, probably about 10, 12 months ago now. And lots of needles are needed. And if it's just acupuncture needles with no hands-on work and no exercise, took a lot of treatments, like 30 treatments, but it was effective. We don't need that many. This is an example of some needling done to a lower back. It looks fairly similar to what we might do here. Shoulder pain related to impingement and arthritis. A number of needles required, and absolutely it needs to be combined in general with exercise and hands-on therapy. It's a very common theme. This is an example of someone's left shoulder. So the one's here on the back, on the rotator cuff, so upper arm area. Typically, we put some in near the ball and socket area as well to help with that area. Headaches, tension, migraine, and neck-induced headaches all benefit tremendously from dry needling, especially when electrical stimulation is used. The benefits are pretty tremendous for this. That's an example of where we put some of those, can just at the muscles at the base of the head, the area we like to rub when we get that headache. Right? Dizziness related to upper neck troubles, there's good research to support that. Tennis elbow, results are equal to cortisone injections for beneficial results. Plantar fasciitis, pain in the bottom of the foot. Folks that I've seen who've used that have tremendous benefit from that. Scars from old surgeries, we talked about that a little bit, but those stiff, painful old scars respond really well with a particular type of needling. Nerve pain related to sciatica. Jaw pain. Tendon issues such as Achilles tendonitis. Carpal tunnel syndrome.
I've had 3 carpal tunnel surgeries on each hand. And they say usually that doesn't happen, but the last time was because I was losing feeling and now I don't have any problems with it.
It's good you finally got the relief you need.
Yeah.
So, why is dry needling effective? How does it work, right? So, some people claim that maybe it's a placebo effect, like someone gets extra attention and care. I'm not convinced that's placebo, but that could be part of it. Like it's extra care. Anytime you add something to somebody's plan of care, it's usually a beneficial thing, right? Dry needling can help improve blood flow to a particular area to help with healing response, especially when electrical stimulation is used. Dry needling can stimulate cartilage tissue and the bone area, and that can be pretty effective for additional benefits when it comes to knee arthritis. Dry needling does 2 things. It increases the body's happy chemicals, decreases the body's sad chemicals. So I think the happy chemicals we're all going to probably recognize. Endorphins, serotonin, norepinephrine, opioids, and cannabinoids. Yes, cannabinoids. And actually helps stimulate the body's own natural production of cannabinoids. Can provide a profound kind of like a bath of happy chemicals in an area and in the body itself. It can reduces inflammation in the body and then decreases the body's sad chemicals, cortisol, and the stress centers of the body. So it's not just beneficial for the region that you treat, it can be beneficial for the body's overall hormone and stress response system. It reduces the level of nerve irritability at all regions. You know, there can be nerves, for instance, in and around a knee that are irritated. The nerve response in the spinal cord can be affected and improved, and also the nerve response in the brain to that body part. All can be modified with dry needling, so it's got a neurophysiological effect, as we call it. And then we talked a little bit about those trigger points and muscles that are in chronic ongoing spasm. They have a compound in them called acetylcholine. That acetylcholine builds up and causes that ongoing muscle contraction, ongoing spasming. Use of dry needling, especially with the electrical stimulation, can calm that down dramatically. It's the equivalent of maybe every one treatment of dry needling I've found been equivalent of anywhere from 2 to 3 or 4 sessions of really deep soft tissue mobilization massage work. And it stretches the connective tissue directly in the tissues. So that illustration here kind of shows the, we'll call it matrix, or the actual large version of the tissues. That is not a nail, that's a needle blown up. Those strands are called myofibrils.
It looks like fish coming to eat it.
Oh. So when a needle is dropped into the tissue and it's twisted, those myofibrils kind of get pulled and twisted around it. So much so that if we wind a needle enough, it's very hard to pull out. It's because those really fine subcellular elements kind of wrap around it, kind of like you pull on a string on a sweater. So that when we manipulate in and around an old scar, that has an effect of softening up. It's a very cool thing to see. When we try to stretch scar tissue other ways, like with massage, we're trying to push down in the tissues and then shearing that scar, this goes right into or right next to that scar, gets it directly. It's a really exciting result. So, summary for dry needling to be effective. There needs to be a high number of needles, somewhere over 5 or 6, and sometimes I've had up to 24 needles in people. Number of sessions sometimes can range up to 8 to 12 sessions. Question is, well, how many do I need to try dry needling? Bottom line is, I think 4. Like if you say you did it once for a long-term condition, you say, oh, it didn't cure it. Okay, well, you're not really giving it a fair shot, right? If you did 4 and there's really no change that you or the clinician can point to, then perhaps that's true. Manipulation of the needles is beneficial, and especially beneficial when it's combined with electrical stimulation. So, questions so far? Good. All right, so what we'll do is, would you mind grabbing a needle cart?
Yeah.
And
Can you do anything for sinuses? Because that's not muscular.
so I know that some acupuncturists do some techniques for sinuses. I don't think we particularly have tools for that. So there are some facial needling that we can do in some of the facial muscles that might affect that, but I wouldn't say, oh yeah, that's in our wheelhouse necessarily.
Okay.
I got a question. I have an implant for urge incontinence. Can you get the needling when that's on? Because it kind of stimulates you down here.
I would prefer not to.
So that means you can't get it in any
Well, you
part of your body?
you could do the needling in that area, and just we probably wouldn't use electrical stimulation while it's
Oh,
on.
okay. Yeah, well, my whole body hurts. I was just curious, because then I just bring it with me and turn it off.
Yeah. We've had individuals do that some of those electrical implants.
Yeah.
Yeah. Okay. Sounds good.
All right, that's
There's a
Where would you
ghost
like it?
trying to escape there.
Right here or to the side?
Right here for now would be better. Massage chair as well.
You were talking about pressure points earlier.
Yeah.
Is that similar to, I don't know if you've ever seen it on public TV, Michael Pincus, Dr. Pincus, and he's got a couple of books that he's pushing on public TV during their pledge drives.
Is that where you're kind of trying to some sort of way to manipulate the trigger points?
Yeah, like if, you've got a bad back, and he can go, okay, let's see, and can you feel this? I mean, does it hurt here? And then he gives it a, kind of knuckles it or something.
So I think so. A couple times as well.
He'll kind of knuckle you there, and oh yeah, I can feel the like if it's a muscle that's knotted, like I usually have on my shoulder. But
I mean, I'm from, there's a whole host of different approaches that have to do with trying to use different devices to kind of grind out those trigger points.
but his is just at least what he shows on the TV programs is just hands.
Hands.
Oh.
So yeah, there's a lot of different kind of techniques, name techniques for those sort of things. I think the bottom line is that there's a reason that's there to begin with, and I think that generally that area needs to be treated. Like if there's muscle spasming or an imbalance, that should be treated directly. But there's probably a cause for that. The cause for that is often multifactorial. It's often caused by some sort of joint restriction in or around that area, or there's an influence that's created from the spine, or kind of a muscle imbalance or poor use of that area. So the most effective treatment is always when you address joint stiffness, nerve sensitivity, muscle balance, work with the muscle tissue, try to find a way to help that person to increase their strength, improve their postural performance and that sort of thing, right? So that's an integrated care, right? So if we're just trying to, I mean, we have Theracanes and you can grind down upper back trigger points or put pressure on them. And I think that can be helpful to kind of alleviate symptoms for a little bit, much like you take some Tylenol. But it's not going to solve it because there's things that need to be changed for that area to work better, if that makes sense. I mean, the osteopaths, for a number of years, the osteopathic profession is a pretty old profession. It's almost as old as the chiropractic profession. They always said you have a joint limitation, you have a muscle imbalance, you have unevenness in posture, and that's held true, I think, over my career that I've seen in training. So I don't know if that answers your question or not, but it kind of puts in perspective, I think, for the trigger points.
Yeah, well, his thing is, it's all, for these shows anyway that he does, it's all the trigger points. And he calls people up out of the audience. Do you have pain? Yeah, I got it here, or I got it here. He just works, like I said, more like knuckling you. And I mean, there's no needles and he doesn't prescribe surgery for anything, well, he can't. He's a chiropractor.
Sure. That's great. I'm all about more natural approaches.
Yeah,
So,
I think we are too, being here.
right. All right. So, so the next thing is let's take a look at the next part of the presentation is what we call a 5-minute miracle, right? But dry needling, it might take a little longer than a 5-minute miracle. So what is it? It's a demonstration of how needling might be used. We will likely see how something might change from before and after. This is not fully representative of how we would assess and treat somebody in the clinic here, but it gives you some example, gives you a chance to kind of see some needling in action, so you can have some sort of idea. So, fair enough? Okay. So, what conditions concern you that brought you here today?
Well, mostly it's my back again.
Yeah, okay.
And it's,
Your hand.
well, my back and my hands, but I think that's arthritis.
Sure.
My back, I don't know what it is, but it's from about here down to the hip on the right side. I mean, the left side seems okay, but
Got it. So they can move kind of stiff?
yeah.
Okay. You okay at being a subject for the benefit of science?
Sure.
Awesome.
Oh man, I want to be a guinea pig.
Do they?
You'll give it a shot. All right, so if you don't mind, come up to standing. We'll go through some process for this. You can take off your jacket there. Where's Sheep's Brewery?
Sheboygan.
Cool. Is it your hometown?
No.
Sounds
They
good.
just got good beer,
Um,
especially their
Good
Wolf Bourbon Barrel,
cool.
18% alcohol.
What?
You only need one beer, and
Well, I drink it so long I'd probably pass out if I drank it.
All right.
from here down to the right of the spine.
Mostly to the right.
Yeah,
How long has it been going on?
a few months.
Got it. Ever have a history of back trouble before?
Yeah.
Okay.
Been here for that.
Yeah. Okay. Anything bringing that on in particular, or just kind of develop?
I just kind of started.
Any associated trouble with pain, weakness, tingling in the legs?
No.
Got it. Disturbing your sleep at all?
At times, if I turn in to sleep, I get the twinge and it wakes me up.
Got it. So that's not good. We need to get you sleeping good, right?
Yeah.
Okay. Fair enough. All right, what I'm gonna do is I'm gonna just observe movements in different directions. We're gonna take notice of how far you move, each of those directions, and what that response is like for you. We'll compare that to after the treatment to see what kind of effectiveness we can notice in the short term. Fair enough?
Yeah.
All right. Sounds good. For this, if you don't mind, I'm gonna return and face towards me. So the first thing I'm gonna do is just reach and bend forward as to touch the floor. Just gonna take notice of how far you go. Any bother with that?
No.
Forward bending's pretty decent here. Come on up and you can almost touch his toes. At a point. So the next thing is, I'm gonna take your left hand, slide it down the side of your left leg, see how much you can bend to the side, and come back up. That looks a little stiff there.
Yeah.
If you don't mind, I'm gonna have you do that one more time and kind of see what that looks like here in your back. Can I bring this up a bit?
Sure.
I'm tucking your shirt there. You okay to untuck your shirt? Thanks. Go ahead and bend to the left. And come back up. She's kind of struggling to get there. It's not easy. Bend to the right. And certainly less easy that way. Right? I mean, anybody can notice that, right? And now see what it's like to bend backwards. Not exactly going to do limbo anytime soon, is it?
No.
No, okay. All right. So, okay. How about down here at all?
Not too much.
So we'll focus our intervention this
Mostly
way.
like from here down.
Fair enough. So the first thing I'm going to do is I'm going to use an alcohol pad just to clean the skin. This is a clean technique. This is not a sterile technique. Perfect.
Even though I'm not gonna feel it, don't tell me you're sticking a needle in, because I have a tendency to anticipate and jump.
All right. So I won't tell you when, but he probably doesn't want to see him, but if you can, these are really tiny in terms of diameter. Barely see that.
Oh my God, what is that?
So now we just think about good places to treat this, and right off the side of the spine. Just tap that in.
Go to the other side too.
How'd that go? What's it?
I was just letting them know if they wanted, they had a better view on the other side. You guys can see the tour from the over.
The particular heads on
How
these.
far in does it go, or does it depend upon the person?
Depends on the person. Like, I'm getting to know his spine, so I chose, you're probably going in on these, maybe up to 50 millimeters.
Yeah.
It's a little flinchy there. That area is sensitive. He's like a champ though.
You feel anything, Jim?
A little bit.
Just a little?
That one that I flinched on, that one hurt, but the other ones.
Hey Jim, we saw your name in the Herald a while back. Did
Yeah,
you catch that article? That was awesome. Just another day, right? Work.
another damn paradise, yeah.
What was it for?
So they were reviewing something that happened in the newspaper a number of years ago, and like this date, 25 or 30 years ago, it was in the Herald. It was an article that appeared in the Northwestern, I think, about you just happened to respond to a call, and was it enter some sort of building? Was it a burning building?
Yeah, burning buildings,
You saved like a couple people.
Mm.
Is that right?
yeah.
Wow.
That's impressive.
Well, no, I have to say that the one that's just about at the kidney on the right side,
Right here.
yeah, that one's twitching.
It was twitching. So are you okay hanging out with that, or is it like?
Yeah.
You okay? Yeah. When I put
It's
it in,
just that,
when I put it in, it twitched quite a lot.
yeah. It still is.
So you can have 12 needles to begin with. I mean, Jim's a pretty robust guy, and there's a widespread area of muscle tension I can see and limited movement in there. So I think he'll do really nicely with this treatment.
How much does it cost to get 12 needles?
How much do the needles cost, or how much does it cost as a patient?
Yeah.
I'll make it closer to one. Yeah, that's what, excuse me.
So, you're one of the patient cost? Yeah, so right now it's $29 per session. In 2021 it was $75. We reduced the price, more people could have access to it.
I thought it was just, what, it was $29 per needle.
Oh, it's for the treatment.
Really?
We're likely going to increase the rates fairly soon.
That means everybody did it soon.
Yeah, that's with an addition to like a therapy session.
Yeah, but it's like $29 a needle, and for 5 it's 100. That's what someone told me.
We have a option for like a 4-pack discount. So that 4-pack means you'd purchase 4 dry needling sessions at a discounted rate.
So now for the fun stuff,
Okay,
electrical stimulation. You turn this up a little bit and let me know when you first
They just
start to
use it
feel
as
it.
like one group, so if they need 8 or 20, it would be the same price, correct?
Ah,
They're just paying per session.
I think I'm feeling
that
it
feels
now.
For
better.
time and
Per
stuff,
time, yeah.
On the left side, correct?
Yeah,
You could turn it up to a real high level, but you don't need to. Sometimes you want the muscle to get really twitchy. In this instance, first session, we generally want to just kind of test the waters. Get used to it. Feel a little bit there on the right side.
little. Not as much as on the left.
What now?
Oh, yeah, there you go.
I can see it.
There you go.
Twitching a little bit. All right. So we're setting up for about 15 minutes total. Should have a good response then. So again, treatments are going to be in place for a little bit. We leave them with, if we're going to leave the room, we'll leave them with an alarm, timer, we have a needle count going in, needle count going out, so he doesn't leave with any extra needles.
Like, I know there was one more needle.
So these muscles are in what are called the paraspinals, or the muscles along the spine, and they can also, those could go a little bit deeper and go on to the actual bony bumps of the spinal vertebrae to get an added benefit. Sometimes it can be really helpful. At times we'll put some on the outer portion of that. Muscle 2, and we direct it inward, so we don't have to worry about going between his ribs and puncturing his lung. That would be a bad day. So what we're going to assess after he's done with this, we're going to assess his mobility, right? And I predict there's a reasonable chance he's going to have increased ease and mobility with less pain. We'll get a chance to see, we'll get a chance to know. And even if he doesn't have that response, we might still decide to do another session or two of this, but there's a decent chance he's going to miss an improvement. This,
And
of
you
course,
have them in at different depths, is that? Like this last one isn't in as deep as the other ones. Is there a reason for that?
when I first put one in here, it was pretty tough
Tight.
and tender. And then he said, "Oh, that one's really bothering me."
Okay.
I went one lower.
And
So,
that's
you know,
where his
I-
pain is anyway.
I kind of want to treat the area, but I don't want to wall up it too
Okay.
much, right? Because he's a tough guy, but this area is obviously very sensitive, and don't want to lighten it up.
Okay.
So there's an optimal treatment dose. Sometimes if you go over that, it's not a good thing. So like water is healthy for life, but you can drown, kind of thing. There's this optimal treatment dose. It's a good question. Again, dry needling and isolation may be helpful. We've had some patients come in and just try to get dry needling. Generally not effective alone, as much as when it's integrated with a plan of care, because we know that hands-on work is really effective. We know that exercise prescription is really effective. We know that moving people through a continuum of treatment in which we work to decrease sensitivity and inflammation is the first step. Second step is to correct some of the root causes of the problem, which is usually joint tightness, muscle imbalance, postural problems. And the third stage is where we're attempting to increase the strength of the muscles and their newfound flexibility. The last stage of recovery is increasing overall strength and durability so that individual is a more robust, strong human being that's capable of doing more things. Less likely to have an ongoing injury with that. That's where the real value of it is. So early on, might use dry needling. We could use it through the whole treatment time if that's necessary. In knee arthritis, if someone chooses to use dry needling, we definitely want to continue to use that. Oftentimes, in some other cases, we'll maybe use it for a portion of the time that they're in the plan of care. It all depends. Some patients try dry needling, they're like, that's the best thing ever. I want it every time. Right? But again, this is a means to an end so that he can move and function better. There's one woman who was coming to us for a while because she was getting no results with cortisone injections and in her knee, and the Synvisc injections were very expensive and not necessarily well tolerated either.
I had those when you had that 30,
I'm sorry.
the Synvisc. Didn't at one point you have to have 3 of them?
I'm not sure if that's true or not.
No, I thought that's what that was when I had it. It was awful.
That might have been what the research was at that time. But
Yeah.
anyway, that individual would come in every few weeks to have it done. It really helped her quite a lot. But most individuals, they receive a treatment within the time frame that they're in therapy. Some individuals with maybe problematic areas might need some treatment on an episodic basis every 4 or 5 weeks. But most individuals, once this calms things down, they can get moving better. We've got a good exercise prescription that they can follow. The nice thing about being in the profession that I am is because we get a chance to use some of the best approaches and then combine them. So we know that hands-on work is really helpful. Everyone knows, oh yeah, massage feels good, right? Well, there's a lot of ways to relieve pain, right? I mean, we can have a drink, we can be in a hot tub, we can get a massage. There's lots of ways to get some pain relief, right? And that's really necessary as a portion of it, but it's not the means to the end. The means to the end is have increased ease of mobility so that we can restore that normal flexibility. Jim's mobility and backward bending is not very good, right?
Either. I'm like,
That's not that unlike a lot of folks, but I think Jim is probably more active than the average guy his age, right? I don't know if you still help out at camp?
Yep.
So he's doing some vigorous work, and he needs his body. And he's up on his feet. You're probably still doing I think I saw you at once at the Grand. You're still helping out there, right?
Yep.
Yeah, so he's doing a lot of stuff in the community yet, right? So his retirement isn't hopping on the bingo bus and going to the tavern every day. Although he might do those sort of things, he does much more than that, right? Like, and that's great. Like, he should be active. That's what we're after. But in order for him to be that active and not start to succumb to some of the things that happen to individuals as they get older and older, is he needs to maintain his mobility and strength. Right?
So as a doctor, are you prescribing that I go to the tavern more?
Only if you invite me ahead of time. So, questions, comments as we continue here.
just the thought
What do you
of
feel,
doing that, I
Jim?
haven't had a drink for
What?
30 years.
Oh,
Yeah.
What are you feeling?
I'm
Anything?
just feeling the twitching, yeah.
So he's feeling
In my
twitching.
back.
I don't maybe see a little evidence
Well-
of twitching here. See these wires move a little bit.
Yeah, it feels like it's twitching.
I agree.
yeah, I can see that middle.
First time I had beer
But
here.
it's not painful or
First time I had
anything.
wine and beer. I don't want to have
Yeah, that sounds like that's a
Well, and when I wanted the sweet stuff, but I'm diabetic, so I can't even have that part.
yeah.
Yeah, and so the kids at school, when I was a school counselor, they couldn't believe I didn't drink.
Yeah, I'm not a huge fan all the time either.
I never drank that often, yeah, I used to go
National
in
Fire Department.
every night in college,
Oh,
on
police and fire.
Friday, or on Thursday.
Yes.
And then I went out once in a while, and I said, oh, here comes it.
Probably doing.
Hey, that door is cracked, you can see it through.
Oh, yeah.
Yeah, down there too, I'm like, wow, you can see through that door.
So we got a few more minutes on the needles, so we'll continue on with some of the information on the slide. So let's just get to the main point on topics. So, good test to know if it's a good time to consult the doctor. Physical therapy is when weakness has increased more than 10% in the past 1 to 3 months. When pain keeps you from standing more than 30 minutes, sitting for more than 60 minutes, or walking for more than 10 minutes. But if you can't get to the back of the store, at Walmart and back to the car without having to rest or lean on a shopping cart, might be a good time to think about it, right? Pain interferes with your ability to sleep at night. This is huge. Oftentimes people just assume, oh, I should kind of be achy and sore and have to change positions. No, you shouldn't have to succumb to that, and we want to restore natural sleep. Sleep is extremely helpful for healing. I want my patients to sleep really well, 'cause selfishly then they recover really well and I look better. More importantly, it's better for their health, right? That when we sleep well, it actually allows for deeper states of rest that help to repair muscles, bones, and joints. It helps relieve stress, helps improve memory, and helps avoid some of the some significant diseases. So being able to return to normal sleep is not just a nicety, it's an absolute necessity.
I wake up in the same position I fell asleep in. I never move around.
Frankly, if pain and stiffness prevents someone from being as active as they want to be, again, Jim's a pretty active guy, wants to maintain his mobility, whatever someone's mobility is. Some people it's gardening, some people it's some other sort of hobby, maybe some sports, working out, spending time with family, traveling. Traveling is a challenging activity. You know, you're sleeping in different beds, sitting in long car rides. Your body needs to be resilient to those sort of things. And just because it seems to be kind of passive, like, oh, I just sit there, like it takes some work, if you will, to be able to tolerate that, and your body should have some good adaptability for that. And importantly, if you're fearful of losing your independence. Our goal is to help people be as active as they can for as long as they can, and not have lots of disability as they age. In particular, wanting people to worry less about you, right? If there's somebody worrying about you, including yourself. So obviously we work to provide education and wellness techniques to reduce pain, increase flexibility, and customize a strength program. We designed a program that is individualized to that person. At the end of a plan of care, that an individual should have a series of movements that they can do, some of which may be for pain relief if they need to, on a periodic basis, a couple of flexibility exercises maybe they do every day, and then a couple exercises they might do in a strength-based program 2 or 3 times a week. Should be a very concise program, not a huge list of exercises, but a handful of things that are key and beneficial. If people want to be a bit more active than that and really get after it with a workout program, we can help tailor one for them as well. And obviously we're willing to assist in any way to help individuals overcome their problem. We receive natural healing, one-on-one treatment, an individualized program to help overcome their problem with minimal reliance, no reliance on medications, injections, or surgery. We can offer some supplementation and lifestyle recommendations. When you leave today, we'll give you keys to steady sleep. That can be real foundational for sleep or for recovery and health. And then you obviously have some stories, testimonials of folks that we've helped in the past. We're able to offer for folks that come to these a free discovery visit, which is an opportunity for you to have an individualized assessment. We'd take a little more time to delve into the history, a bit more time than we did with Jim in this session, to get to understand what's going on, what your concerns are, what's contributing to your symptoms, and find out what solutions there are available for your condition. Ahead of that, we can find out what your insurance coverage is. If you give us that information, we can pre-check all that, so that at the end of that, you'll know what you're looking at for a prospective plan of care in terms of your commitment, time, and cost.
Is this covered like by Medicare or
No,
supplements?
no,
No?
no. Medicare started claiming they are covering it. It's only if it's done by a doctor of Oriental medicine.
Oh my God.
I
How many of
don't-
those do we have here?
I don't know any duly licensed doctor of Oriental medicines and doctors of physical therapists. I don't think they're a fictitious thing, so I think they're just trying to play it both ways. And
Well, you know, my family practice doctor was a DO, and I don't know if it was Medicare or the insurance companies said she can no longer do those manipulations. Isn't that kind of interesting?
well, she won't do them, it's just they may not be paying for them, but yeah, it's unfortunate. Write a script for a risky surgery or expensive medications, and they're all on that. I can't figure that out, but that's the way it is.
Mm-hmm.
So, at the end of the 20 minutes, we're going to take off these wires. These are simple clips that go on those needles. This is a battery operated unit.
So you could do it if you don't have electricity. Just with a flashlight.
You could.
Yeah, we had a clinical day like that once.
Really?
One of those spring storm days where the power went out. Yeah, it was pretty wild.
And you must have daytime light.
Sent someone to Menards to get some of those lights.
I'm trying to think, I don't even know if I was here during that time.
So we pull these out. Create a little bouquet of these. Ooh, that was a sensitive one.
Yeah, I know.
Don't give it away.
Captain Obvious, right?
It's so weird he didn't react to any of the other ones.
So I'll suspect at that area, there's probably a significant spinal dysfunction that needs mobilization and manipulation, maybe some new tissue work.
Yeah, there's a nerve right there. It's red in there too.
And just, if you don't mind staying here for a moment, what's that? Good. So, not sure if you notice anything without moving a whole lot before and after that, as of now.
What do you mean?
What do you notice that's different?
I feel shorter.
You feel shorter.
Oh, that's how that happened.
Wow. And to me, actually, looks like he's standing a little bit taller, but maybe that's visual thinking.
He looked more limber getting up.
Yeah.
Go ahead and bend forward, please, and touch the floor.
Oh my.
Boop. Just like that. Right?
He's closer.
It's closer. Mhm.
Nice. So we're starting to do the happy dance, right? I mean, he's started to do really well. I'm gonna side bend this way. A little more mobility there. I think last time we went right first.
Yeah, that is further.
This is not a natural movement for people to do. But he knows to get a little further, he's got to bend a knee. So we're not where we need to be. That's a much different spinal movement. You're okay. You're all right. Now bend backwards.
Yeah, that's
Not sure.
actually
I'm not-
further too.
I'm not sure he's gonna be my limbo partner quite yet, but
Right. But
looks a little bit different. Right?
start, yeah.
He's gonna at least be able to pass the first round, maybe. So hopefully he's
Let's
next
get
round.
on, then I go to the bar.
So do you notice difference in terms of those movements?
It seems a little bit, like, I think I go back further. I know I can go forward further.
Right. And generally with spines, you wanna keep and maintain and improve backward bending as much as possible. Side bending of the spine allows your spine the capacity to do more backward bending, because otherwise you start to get more and more forward as you age, if you don't do some flexibility stuff. Some of that is some natural age-related stiffness that does occur.
Yeah.
And some of that is just habits. We don't do a lot of overhead stuff. We don't do a lot of flexibility stuff. But that's a good outcome. So I'd say that's a favorable outcome, and we'll chalk that up as another 5+ minutes miracle. So thank you so much, Jim. Appreciate it. Just choose one of the times that are up on the board, and then I think you have a sheet that you can fill out your insurance information if we already don't have that. And we can let you know then at the end of that discovery visit what it looks like for solution like you, and what that looks like in terms of cost and number of sessions.
I don't have my appointment book with me, I can't do it.
What's that?
Listen, I don't have my appointment book with me, I can't make an appointment.
So you can let us know. So then obviously I like doing public education. I think it's necessary. We present at the senior center on a monthly basis. We've been at the YMCA, different retirement areas, pick a community center for their seniors. So I like doing public presentations. So if you have a group that you're part of that would like some talk on health related issues, I'm happy to do that. Is it next month or this month? We're doing the one at the senior center on how to become a good healthcare consumer.
That's this month, so that's next Tuesday at 1.
I'm gonna get cracking on the presentation. Looking forward to that. I mean, it's literally how to become a good healthcare consumer. Because I think that's a useful skill that people need. I just had an encounter with the healthcare facility, and I was, let's just say, I think that it's a skill that we need now. That the healthcare system now is vastly different than it was just a couple of years ago. A whole sort of reasons, and the better off we are able to prepare ourselves for any medical appointment, the better off we're going to be. So that's not even directly related to the typical things that we treat here, just like we want people to be better healthcare consumers.
I've had friends that lie through the whole thing, I say, why are you going?
Yeah, it doesn't,
No, I don't, you know what I mean, I don't get it.
yeah, that doesn't do anybody any good. And
Yeah.
we've done them on sleep, for the benefits of sleep and how to think about sleep and ways to do some basically no cost things in order to improve sleep. So wide variety of topics we do. So anyway, reach out to me if you have a group that you'd like to present to. Any other questions?